in this conference?
Well, I am one of many hundred healthcare workers coming to Jordan because Jordan has taken an important initiative with Dr. Fauci and Dr. Omar to think about how we can support the Palestinian people in Gaza and in the West Bank, and how we can start to discuss how we can rebuild what the Israeli occupation forces have been destroying, bombing, killing of healthcare in Gaza.
All things.
So I come from Norway in order to provide, to learn, to listen, and to share my experience.
Very good. Why do you think that Israel has been obsessed with Palestinian hospitals?
I think that this has nothing to do with the military struggle. This has to do with the settler colonial project to occupy all of Palestine, from the river to the sea, as they have in their flag. They have the two blue lines, you know, Jordan and Mediterranean, and with the Star of David in between. And in order to obtain that colonization, they need to eliminate the Palestinian people in Gaza. And to do that, they need also to destroy the hospital and the healthcare system. Because, you know, at the end of the day, the hospitals and the healthcare system and the ambulances, they are the pillars of security and safety in society. When your child gets ill, you can go to one of the beautiful hospitals in Jordan. Around the clock, 2 o'clock in the morning, somebody there to take care. I call the hospitals the temple of mercy in a society and the security network for people. So when the Israelis are attacking the hospitals, not only Shifa, all of the hospitals, they are attacking the fabric of the Palestinian society in order to erase Palestine in Gaza and in order to discourage the resistance will of the people of Gaza. That's why they attack the healthcare.
Very sad. Yes.
Oh, it's not sad. It's criminal.
It's a criminal.
It's a genocide.
Genocide. Yes. How confident are you that there was no Hamas infiltration in the Gaza hospital?
I think I've answered that question 500 times to the media. I've been working in Shifa for the better part of 20 years. I've been there working as a doctor in 2006, 2009, 2012, 2014, and in between. Also in between the attacks. I've never seen any Hamas soldiers there. I've never seen any commanders. I've never seen any tunnels, and I've been allowed to go wherever I want and take the pictures I want and talk to anybody. And don't forget that the Palestinian leadership in Gaza, they said during the third week of the attacks, when all these accusations came up, they said to the international community, make a committee for investigation. They can come and look at all our hospitals. We have nothing to hide. Who said no to that? Israel. Because they know they were lying, and the Israelis are liars. They lie in the media, they lie in the army, they lie in the Hashbara every day. I don't believe for a second that Palestinians are so stupid as to have a command center in a hospital. Because they love their hospitals and they need their hospitals, just like we do in Norway and you do in Jordan. So these are all false claims, and there has been absolutely no evidence on the table from the Israelis to prove that the Palestinian hospitals have been used or misused as military command centers.
What's the biggest medical need in Gaza?
Number one, stop the bombing immediately. Number two, open Gaza for free influx of food, water, fuel, medical supplies, medical teams, field hospitals, immediately, under UN control, not under Israeli control. Number four, start immediate to treat the avoidable death patients. Those are the patients suffering from diabetes, who have pregnancy, who have cardiovascular disease, who have cancer, who today have no medical treatment facility in Gaza because of the bombing and the siege. And protect the children of Gaza, get them warm clothes, get them food, water, shelter, security, and treat the complications from the war wounded. Don't forget there are 60,000 war wounded in Gaza, and maybe 20,000 of them have complicated war wounds with infections, with multi-resistant bacteria. They don't have the antibiotics they need in Gaza because of the siege.
They have nothing.
And then, well, they have the resistance.
Yeah, resistance.
They have the will of resistance. They have their sumud. They have the sumud, and they have the good people of Gaza. That is a lot. So we need to support them and not to make a parallel system, because the healthcare system in Gaza should immediately be reopened, rebuilt, and repaired. With the Palestinian healthcare workers, with the support from the international community. And every one of us, every day, can do more to show solidarity with our brothers and sisters in Gaza and in the West Bank. And we need to do that. It's been 4 months of horrible attacks. It needs to stop now.
Thank you very much.
شكرا كثير. كلنا غازا. فلسطين حتى نصر.
شكرا.